Zoom recording. So thank you all for joining us. This is Elevate Health's Community Care Conversation for April 2021. And today we are talking about what everyone should know about advanced care planning. As we start with every meeting here at Elevate Health, we always want to share our core values, which is community, empowerment, equity, inclusion, integrity, innovation, and reverence. And our objectives today is to discuss what is advanced care planning. That's a typo that I'll fix. The importance of advanced care planning, becoming familiar with the documents that are used in advanced care planning, and any feedback that you may have after this. If you have suggestions for any future community care conversations, please email me at ask.elevatehealth.org. And who we are. I am Bjorn. I'm the Director of Integration and Transformation here at Elevate Health. And I host these events every month and bring wonderful speakers in to talk about different subject matter. And it's the day of Kim's, because Kim Stagner is here from Honoring Choices Pacific Northwest and has several years in the nursing field, and we're really so thankful to have her join us today. And I'm going to go ahead and let you take over.
Okay, thanks, Kimberly. Let me just get to my presentation here. Okay, so thank you all for attending, and I'm so glad that I was able to come and present to you. Before we get started, I just want to acknowledge that Honoring Choices Pacific Northwest is based in Seattle, and we would like to acknowledge that we are on the land of the first people of Seattle, the Duwamish tribe. And we like to not only honor the land the land itself, but the Duwamish tribe. So wherever you're joining us from today, I think most of you are from the Tacoma area. We just ask you to join us in acknowledging and thanking the Indigenous people for their ongoing stewardship. We are going to, I think Kimberly already mentioned, this will be recorded, and I would encourage you to use the chat box at the bottom of the Zoom window. So if you have questions, we'll monitor the chat box as we go through. I will try to stop periodically. I think we'll have plenty of time to answer questions, but I want to make sure I cover all the material. So if I'm feeling like we're running a little behind, I may just wait and answer the questions towards the end of the presentation. So first of all, I'd like to congratulate all of you for attending today, because you've actually taken the first step, which is learning more about what is advanced care planning and what are advanced directives. So let me start by,
I just want to ask you, Kim, really quick, when would you like me to launch the poll?
Oh, yeah, why don't you go ahead and do that before we get started? I forgot about the poll, sorry.
It's okay. That's why there's two of us. All right. We have 4 of 9. Let's see. Oh, and probably the 2. I don't know if I can even answer this. Probably not, because I'm in control. I will share that I do have an advanced directive.
Okay, so we are, it looks like we're about 50-50, which is amazing. We're going to share some data a little bit later, but I'm glad to hear that some of you have completed your advanced directive. So I'm hoping today that you might hear information that either confirms what you've already done in your advanced directive and your advanced care planning, or might raise some questions, or maybe even think you might be thinking that there's maybe a couple more things you want to do just to maybe wrap up or tie a bow on your advanced care planning. So even if you've completed it, I think you'll find that you'll maybe hear some information today that might help you. Okay, so let's go ahead and I think, can you guys, I don't know if you all saw the results of that, but they're the results. Sorry, I'm having trouble getting my screen to move. Okay, so I'd like to start by just telling you a little bit about who Honoring Choices Pacific Northwest is. We are actually a joint initiative between the Washington State Hospital and Washington State Medical Association. We're nonprofit, and all the work we do is philanthropic, which means that all the presentations, the materials that we share are free to anyone who wants to participate. Our vision is that everyone will receive care that honors personal values and goals at the end of life. And we do this through a two-pronged approach. One is outreach to the public, which is presentations such as the one that we're doing today. And I'll talk a little bit later about some other things that we do to outreach to the public. And then we've done a lot of work with the healthcare and community organizations throughout our state. So most of the large healthcare organizations in the state of Washington participate with us in some way. And many of them have trained facilitators who help people with conversations. They also have done a lot of work with their electronic health records to create places to store advanced directives so that they can be easily retrieved and used at that time when healthcare decisions may need to be made. If you're interested in knowing more about who our specific partners are, we'll be sharing some of the websites at the end of the presentation, and I think Kimberly will be mailing out a copy of the websites as well. And on our website, we'll list all of the various partners that we work with throughout the state. So our goal is that everyone over 18 will accomplish three things. One is talk about it, write it down, and share it around. So in order for people to really know what's important to them, they really need to take some time to explore their goals and values, to think about what matters most to them. And then they need to be able to formally name what they want so that it can be clearly communicated. And then last of all is to share it around. Share it with your healthcare agent, share it with your other family members, share it with anyone who you think might be at your bedside. And the reason for that is so that they can help advocate so that you can get your wishes honored at the end of life. So what we'd like to start with is a question, and we're just going to take a 30 seconds here, but I'd like all of you to just take a minute or so and think about what brings you joy. And if you're comfortable, maybe share in the chat box some of your thoughts on that. And while you're doing that, I can go ahead and just share for myself what brings me joy. And that would be being independent with my activities of daily living, my ability to live independently. And then it's important for me to be able to get outside every day and either take a walk or go on a hike. And then I think the other thing that's important for me is communication with friends and family, whether that be via phone, texting, in person, if that's possible. So I see a few people have written in the chat box, the ocean, music, my dogs and my garden. I run every day with my dogs, family and music, reading, dogs, and my child. So everybody's got some great ideas there. So I want you to keep these thoughts in your mind, and we're going to be talking in a little while about how what brings you joy relates to advanced care planning. So let's talk about what we mean when we're talking about advanced care planning. What are we talking about? So advanced care planning is a process of communication between individuals and their healthcare agents to understand, reflect on, discuss, and plan for future healthcare decisions for a time when individuals may not be able to speak for themselves. So a few things I want to bring to the forefront here is that your healthcare agent will only speak for you if you speak for yourself. So as long as you're able to communicate, whether that be eye blinking, waving your hand, your head, you're still able to make your own healthcare decisions. So the healthcare agent only steps in if you're not able to communicate. It's also not a one and done. So it's a lifelong process. Our goals change throughout our lifetime. So what's important to us at age 20 or 30 will be very different from when we're 50, 70, and 90. So it's important that you revisit your advanced care planning. And we have what we call the 5 Ds, and I've added an M to that. And so some of the common life events or times when you may want to stop and revisit advanced care planning would be when there's a marriage or a divorce, new diagnosis, a decline in health, or every decade, or a death. So if there's been a death in the immediate family, you may want to revisit your advanced care plan to see if you need to rename another healthcare agent. Or maybe the dynamics in the family have changed and you need to rethink who might be your healthcare agent. And we'll talk in more detail in a little bit about, what is a healthcare agent and how do you select that individual. The documents where an individual writes down their goals and values are referred to as the advanced directives. I want to mention that there are a lot of different kinds of legal documents. So the ones that we're going to be sharing with you today are not the only ones that are out there, but these are the ones that we have created with Honoring Choices Pacific Northwest. They have had input from the large healthcare and small healthcare and the community organizations within our state. They've been reviewed by the legal department. So these are the ones that we are most familiar with and the ones that most of our healthcare organizations now are familiar with. But you also may be more familiar with the 5 wishes. There's also Prepare for Your Care, and we'll be sharing the websites for those resources as well. So these aren't the only documents that are out there. A couple of other things to mention is that it's not a requirement that you complete any documents. So there's no law that says everybody has to have an advanced directive or has to name a durable power of attorney. So we'll talk about some of the pros and cons if you elect to not complete any documents, some other things that you might do in lieu of a document, and maybe what the other options are if you do not choose to select a healthcare agent. You don't need a lawyer to complete these documents. So that's the other thing that we like to share with people. I always thought, oh, I have to go to the lawyer to get my advanced directives done. You do not need to go to a lawyer. The 2 documents that we'll be sharing with you today have places for witnesses and or a notary. So if they are witnessed and or notarized, those become the legal document and there's no need for an attorney to be involved. Any questions before I move on? Just give people a quick check-in. Oh, the PULSed I didn't really talk about. We'll talk about the PULSed as well. That is another type of advanced directive. So we'll be getting into more detail with all of these forms in just a few slides. Okay, so how can planning help us later? So these are just a few of the statistics that we like to share. And I think what this shows is that there is a disconnect between the desire of wanting to talk about our advanced directives and actually doing it. So you can see about 90% of people feel it's important, but only 1 in 3 or 4 of us have actually done this. And if talking about it is difficult, then putting it in writing is even more challenging. So again, the statistics show that people still think it's important to put their wishes in writing, but again, only about 1 in 4 people have actually done it. So the statistics, or the little poll that we did earlier, was actually better than what the national average is. And then without the discussion or some documentation, people find that the care they receive doesn't really match what their wishes and goals would be at the end of life. So again, 70% of people would prefer to be at home, yet 70% of people either die in long-term care or the hospital. So without that discussion and pre-planning, advocating for what your wants are, people sometimes find themselves in situations that aren't really what they would truly want. And then there's the aftershocks of death that impact the surviving loved ones. You can see there's almost a 9-time increased likelihood of prolonged grief if someone dies in the ICU versus home with hospice. And again, the PTSD if the loved one dies in the ICU. And a lot of times, I think what happens is these people find themselves in a crisis situation, or they've never taken the time to actually have a conversation. And so decisions get made, or care is provided that the individual wonders if they'd made the right call. If they, I've had friends who even 4 or 5 years later, after their loved one died, are questioning themselves. Well, I wonder if we should have given them that much pain medication. I wonder if they should have had that much morphine at the end of life. Maybe we shouldn't have done that. So they're second guessing themselves because they didn't have the opportunity to have that discussion up front. So how can planning actually help us now? And this, I love this part because I think I like to think of advanced care planning as really about how you want to live, not really about how you want to die. So how this relates to current care is that planning can translate individuals knowing their values and preferences. And in turn, this means that throughout their life, they can think about care and treatment through this lens. And how this helps you is that it can create a stronger partnership with your providers. It increases literacy and understanding, and it really helps empower individuals to advocate for their needs. So I have a story I want to share so that this can be translated into a real scenario. And the example is actually a situation that my dad is facing right. He's 90 years old. He's been in relatively good health. He's independent, lives alone, still drives, does yoga every day, walks a mile, cooks, and mentally, pretty alert. Well, he was recently diagnosed with bladder cancer, and the proposed treatment is that they'll go in and remove the tumor. He may end up with a catheter for a couple of days, and then they'll give him some chemo, and hopefully, that will take care of the problem. Well, I also want to mention that my dad is a retired urologist, so he knows what the long-term prognosis and complications might come about from having this surgery. So he is seriously contemplating whether he's going to move forward with surgery. His opinion is that I'm independent. I'm able to do my yoga. I can walk. I can play pinochle. I can get out and about. If I have surgery and I'm left with an incontinent bladder, and that's going to limit my ability to go out and be independent or participate in some of the activities that I like to participate in. And I am 90. So, I probably have a couple of years, even if I do nothing. So you can see where his knowing what's important to him and what his values and goals are is helping him to think about what treatment might be most appropriate for him. So he is going to be talking to his surgeon about that, and we'll see if he decides to go forward or not. All right, so let's get into the actual documents. The first two documents we have is the Advanced Directive, or the Durable Power of Attorney for Healthcare. Now, this is the document where you legally name your healthcare agent, and it prepares that agent to make some decisions for you. The second one is the Healthcare Directive, and this you might also know as the Living Will. And I'll talk about both of these in more detail in just a second. But the main thing I want to point out here is that these two documents are to prepare for a future healthcare event, the what if scenario. So this is where you might be a healthy 18-year-old, really don't have any health issues, and you have some unforeseen event, a car accident, a work accident that leaves you unable to speak for yourself. Then these documents are meant to not only provide the person who will speak for you, but also guide care based on your goals and values. The POST form is for current healthcare, and it's called the Physician Orders for Life-Sustaining Treatment. It was recently renamed to Portable Orders for Life-Sustaining Treatment. So we don't have the current POST one on this screen, but it looks very similar. It's just going to be renamed Portable Orders. Now, the POST is meant for someone who may be seriously ill or medically frail, and you wouldn't be surprised if that individual were to die in the next 1 to 2 years. That form is really meant to have a conversation between the individual and their provider, so that the provider can talk about the prognosis, what perhaps might happen based on that individual's medical condition or situation. And then they go through the life-sustaining treatments that that individual might want or not want. So then it requires the legal signature and it becomes a medical order. So it's really meant to direct emergency personnel as to what kind of treatment that individual wants based on their current medical situation. It's not necessarily for future healthcare. We'll talk probably in a little bit more detail about the POST in a few minutes, but just kind of want to make that clear that the first two are for future healthcare. The POST is based on a current medical situation. All right, so let's talk about the Durable Power of Attorney for Healthcare. This document was just revised actually this month, April of 2021. So this is a brand new revision. And it's kind of in two different formats, or there's two main pieces to this. And the first is where you document who you choose as your healthcare agent. And then we also have alternate, 1 and 2 alternate. And we ask people, well, why would you choose an alternate healthcare agent? Well, a few reasons. One is, what if the primary agent and you are in the same accident? A lot of times, husband and wife. So we suggest and encourage people to name a second and a third agent, so that if the primary is unable to fulfill that role, there's alternate people in line. The other reason would be to support the primary agent. So if that primary person is having to make some difficult decisions, and the alternates have also been involved in the conversations and they know what your goals and values are, they can help support that primary individual in making those decisions. The second part of this document really goes into describing personal values and goals for treatment. So it asks things like what we already did. Describe what a good day looks like, what brings you joy, what's of value to you. And it it allows you to, there's some check boxes that you can use, but you can also free form, there's blank lines where you can actually just write what's important to you. It also asks about cultural and spiritual practices that are important. What brings you comfort? There's a section on pregnancy in there. So, there's other questions that go on behind this first page. And the idea is really to promote that conversation, allow you to write those values and goals down so that your healthcare agent can reflect back on that to help make decisions about care that you may want or not want. Okay, come on here. Oh, there's a little thing here. Must be witnessed or notarized. We talked about that. So within the document, there is a page for witnesses and or the notary, and there's the requirements for the witnesses are listed on the document. So you'll want to make sure that whoever you have witnessed your document meets all the criteria, and then it becomes a legal document. Okay, so here's where we get into why should I choose my durable power of attorney for healthcare or a healthcare agent? Well, if you elect not to choose a healthcare agent, then the state has actually already decided for you who that person would be. So we'll just take a brief look at the hierarchy here. And the first would be a guardian appointed by the state. Well, guardianships are long processes, can be expensive. And so that doesn't happen very often. Occasionally it does, but the guardian would trump anybody else. And then the second would be the named healthcare agent with healthcare decision-making authority on the advance directive. So if you have completed your durable power of attorney for healthcare, that person is the one who would make decisions for you. Then it goes to your spouse or registered domestic partner. Now that's even if you're separated. So unless you have gone back, if you're separated and you go back and you revise your document and you name someone else, the named healthcare agent would still take trump over your spouse if you're separated. Hopefully that made sense. And then we go into your adult children, your parents, your adult siblings, grandchildren, nieces and nephews, aunts and uncles, and even a close friend who meets certain criteria. So a couple things to mention here. Any of those boxes where there's multiple people, so like your adult children, they all have to be in agreement to the care that you receive. So if you have 3 kids and 2 are in agreement and 1 is not in agreement, the providers really can't move forward until they get consensus between all 3. So if you're very concerned about one of your children being your healthcare agent, you may want to name that person on your document. You can certainly have conversations with the other 2, but the one that's named on the document would be able to make the decisions, even if the other ones disagree. Let's see here if I've missed anything. Couple questions that come up is, does my healthcare agent, are they financially responsible for my care? No, the durable power of attorney for medical decisions is only there for the medical decision making. They're not financially responsible. Now, if you have a financial durable power of attorney and they happen to be the same person, then yes, they would have something to say about the finances, but otherwise they're strictly the medical decision maker. Another question we often get is, does my healthcare agent have to be a family member? No. They do not need to be a family member. That's the whole purpose of doing this, is so that if you don't want your family members to be your healthcare agents, you can select anybody that you choose. And it doesn't matter. If your family is in disagreement, they still legally will follow what the opinion or the advice of the healthcare agent that you've appointed. One thing we kind of like to challenge people is to look at this list and ask yourself, are you by default the healthcare agent for anyone on this list? So do you have a spouse or parents that are alive that you haven't been named legally the healthcare agent for? If they haven't filled out a document or elected someone, then by this hierarchy that the state has decided, you would be their healthcare agent. So you might think about that in terms of having a conversation. So if you're by default the healthcare agent for your spouse or maybe your parents, you might want to suggest that you have a conversation and say, hey, you know, I went to this class. I learned that if something happens to you, I would be your healthcare agent, and I have no idea what you want. Do you know, so can we have a conversation? Can we maybe talk about what your wishes are, just so that I have some idea what you would want if I was called upon to make those decisions for you? The best advice that we offer is to formally name someone, complete the durable power of attorney for healthcare, and have a discussion with that individual so that you know that you're going to be getting the care that best matches your goals and values. All right, I think I'll pause for just a minute and ask if there are any questions before we move on to the next section. Okay. Okay, so how do you select a healthcare agent? Well, first of all, they should agree to the role. So people don't feel comfortable in that role. I think it's important to ask them and then ask if they're willing to talk to you about your goals, values, and preferences. They would be able to follow your decisions even if they don't agree with them, and make decisions in difficult moments. So for those of you who have already completed your advanced directive, you might think back to the person that you've identified and have you talked to them about your goals and values? Have you asked them if they could follow your wishes? And do you think they'd be able to make decisions in difficult moments? So couple of comments here would be the following your decision. So in some conversations, what we've had is that, you know, the person they've identified as the healthcare agent really, you know, isn't necessarily on board with the decisions that the individual is electing. So maybe they do want full treatment, maybe they don't want full treatment, and the healthcare agent isn't quite on board. And what we have to remind them is that this isn't really your wishes for that individual. Your job is to advocate to make sure that they get the care that they want. So you're just facilitating, you're the advocate, you're not the one that's making the decision. So that sometimes helps people when they may be at odds with the care that someone wants, is just to help them understand and remember that they're not making that decision, that you're just helping that person get the care that they elected to have. Also, I think this is where that the alternate agents can come into play, especially the one making decisions in difficult moments. Oftentimes we see spouses that are one another's healthcare agents, and that can be very difficult sometimes for the spouse. So if they've got the alternate there to say, oh, remember when dad told us that he wanted X, Y, and Z, you can help that spouse to follow through. All right, we're going to move on to the healthcare directive.
Hey, Kim,
Yes,
there is a question in the chat.
I see that. Yes, can we get copies of the PowerPoint after the class? Yes, I believe Kimberley has a copy, and we can make sure you get a copy. And I have many clients who are completely alone. What can they do to make sure their wishes are met? So that's a great question. We have worked with some people that don't have anybody that they can identify as a healthcare agent. So we encourage them to still complete the document, because at least it's something that they have written down that tells people what's important to them, what their goals are. Even if they don't have a healthcare agent to advocate for them, I would encourage that individual to share it with their provider, make sure that that gets scanned into the medical record so it's available if they show up in the hospital, so that at least they have some idea what that individual would want. I think there's also people who have, if you have the finances, you can pay people to be your healthcare agent. So there's also people out there who can be hired to be healthcare agents. And attorneys may do that for you. You would have to talk to, again, you'd have to pay for that, but you want to talk to your attorney and say, if I'm found in this condition, would you be willing to be my healthcare agent for me? So that's another resource for people. And I think there might even be a resource for people who, I have to check with my coworker, but I thought I heard that there was maybe even an organization for, oh, I forget what they call it, or orphans, orphans, and they're individuals who don't have anybody who can be their healthcare agent. So I can find out about that as well. But that's what I would recommend for people who are alone. Definitely do the document, fill it out, give it to the provider, make sure it gets scanned, and make it available to the care provider. Okay, all right. All right, so let's move on to the healthcare directive. So the healthcare directive, also referred to as the living will, is this document is specifically if you want to choose whether you want life-sustaining treatment such as nutrition and hydration, but there are certain situations that have to be met in order for this document to come into play. One is that you have a terminal condition or a permanent unconscious condition. So this is really a directive to providers that if you are in one of these situations, a terminal condition or a permanent unconscious condition, that this is the specific care that you would want. Now, a lot of people feel that if they've completed the durable power of attorney for healthcare and they've talked to their healthcare agent and they've already written down a lot of their goals and values on that document, that would suffice and they would allow the healthcare agent to make any decisions about nutrition and hydration or life-sustaining treatments on behalf of the individual. So it's really, again, I just want to stress, it's not a requirement that you fill out any of the documents. Some people only fill out the durable power of attorney for healthcare. Some people only fill out the healthcare directive. Some people want to do both. So again, it's just another document that you can complete if you are concerned about making sure that your wishes are followed in these particular situations. Maybe attaching it to the post would be helpful, as I always recommend my clients keep post on the refrigerator. That's a great example. That was in the comment. Again, this document has a place for witnesses and notary. I want to point out that the witness requirements for the healthcare directive and the durable power of attorney for healthcare are not exactly the same. So you want to make sure you read the requirements for both and that you follow those requirements. The primary difference is that the witnesses on the durable power of attorney for healthcare do not need to personally know you. So you can have, someone in the office just witness your signature, whereas the healthcare directive, the person witnessing does need to have some personal knowledge of who you are because you're making some, medical decisions here. There is a little bit of a difference in the witness requirement. The other difference is that it depends on like providers, people who work in the office. if you live in like a long-term care facility, an adult family home, the caregivers, anyone who might be considered a caregiver, cannot be a requirement, cannot be a witness for the healthcare directive. So just pay attention to those if you choose to go with the witness instead of the notary. And I didn't talk much more about the post. I think we pretty much covered that earlier. I think the primary thing with the post is that ideally someone has already had their advance directive and their durable power of attorney documents done before they end up in a post situation, but a lot of times they haven't. So they may find they have a terminal condition, and the first time they have advanced care planning discussions is when they get the post. So it's still a document that reflects an individual's wishes for care. And as I mentioned earlier, it's typically for people who are medically frail or have a serious illness, and you wouldn't be surprised if they were to pass away in the next 1 to 2 years. And it does need to be signed by a provider in order to be an actual order. There's a couple of questions. I don't know if this was addressed. Can a probate be considered a healthcare agent? I don't know if I know what the term probate means in this situation. I don't think so unless they're named on the legal document or they fall under that hierarchy. So if it's one of the family members, I think that's what I would say is they either have to be legally named on the document or it's going to default to the hierarchy. So I don't know if that's answering the question. And then the other, if you travel out of area you live, should you take this information with you? We encourage people, yes. It doesn't mean that every state has a slightly different document, but what we found is that states are thrilled if you have an accident in another state, they're thrilled to have anything to go off of. So they're not going to challenge it to say, well, this isn't our document here in Idaho, we can't use this. They would use it, they would accept that it's from Washington State, that it's legally, it has witnesses or a notary. So we would say, yes, encourage people to take a copy. They don't have to take their original, but at least take a copy with them if they're traveling. Now, one thing we've suggested to people, if they live 6 months a year, they're a snowbird and they actually live in Arizona or California, they perhaps might want to just complete a document for that state for the time that they live there. So they have one for Arizona, one for Washington State, if they're going to be, if they physically live there for a long period of time each year.
And Kim, I would also share to have a copy with your provider, your personal
Yes.
provider, because if you are in an accident in another state and they at least have listing of your primary care provider, then they could potentially get those documents from that group.
Yes.
So.
Another thing I wanted to mention is we have a little wallet card that is part of I can show it here on the screen. It's part of the durable power of attorney for healthcare. So we encourage people to complete the wallet card, and that names your healthcare agent, their phone number, and it says my advance directive is on file at, and you can list where they could get a copy of your advance directive. So at least carry the little wallet card with you. So if something happens, somebody would pull out the wallet card and have a place to start. So that's another resource that we encourage people to carry with them.
The questions are coming in. We got more questions.
Yes, I see. If you travel, how do we get copies? We are going to give you the website for Honoring Choices, and all of our documents are on the website. And does a DNR supersede a power of attorney? Does a DNR supersede a power of attorney? I'm not sure I understand the question. If somebody has completed a post, I think you're talking about a post, that's where the do not resuscitate would be. That would be a medical order. So that would supersede the power of attorney, because you've had a conversation with the doctor's written, do not resuscitate, that's the wishes of this individual. And are you asking if the power of attorney, the durable power of attorney, can say, no, 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 go ahead and give them all the treatment they want? I would say the DNR is going to supersede.
And
Yeah.
I will say that sometimes, depending on the provider, the physician, and what information they have at the time, they may let the power of attorney override.
Yeah.
And I just
guess
know that from working in the hospital as a social worker, it gets complicated. And that's why we're having this conversation today, so that conversations are happening early and you have the right people making the decisions for you, so that they're not in conflict with what you want.
Yeah, I guess I'm thinking of the post, if somebody was found down at home and the medics show up, and the durable power of attorney says, no, 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 just ignore that post form and give them give them CPR. I don't know. I don't know what the medics do, to be honest with you. I don't know if they would do it or not do it. They legally would be fine if they chose not to do it, because they would be honoring the person's wishes. And actually, it's considered a medical error if care is not followed that a patient would want. So, somebody else could come along and challenge it to say, why did you give this person, resuscitate this person? They clearly said they didn't want it. They had the legal order. It was signed by the doctor. This is a medical error. It needs to be challenged. So it could go both ways. I think that's why you want to make sure that whoever you select as your power of attorney for healthcare is going to honor your wishes and understands when you're signing a post and a do not resuscitate, why. So, okay, so how do I make sure that my wishes are best communicated? So you want to be able to capture key information on the document. And that would mean trying to avoid using words that can be ambiguous, like, I don't want to be a burden to my family. Well, burden means different things to different people. Are you meaning a financial burden, a physical burden, a mental burden? So it would be better to be specific and say, I don't want my family to have to be my personal caregiver by giving me a bath and take me to the bathroom. That's a lot more clear than I don't want to be a burden to my family. Another would be, I don't want to experience any pain. So does that mean you want to be totally sedated so that you're not able to recognize or communicate with family and friends when they come in? Or does it mean you want to be sedated but be aware enough that you can still communicate with family and friends? So again, those are things that you want to clearly communicate on your document, but also talk to your durable power of attorney for healthcare so they can advocate for you. Writing not applicable when appropriate. So if there's something on the document that doesn't apply to you, you want to either put a line through it or write not applicable. What that tells the person who's reading the document is that you didn't accidentally miss that section, but you didn't really have anything specific to say about that section. Crossing out unwanted words, phrases, or sections. So if there's a word or a phrase that doesn't really resonate with you, you want to go ahead and just, I mean, it's your document, so cross it out and use those lines, the free form lines, to really clearly state what it is that you're looking for. We've already kind of talked about knowing the different requirements with the witnesses, talking to providers and those who matter. And above all, be patient with yourself. I have to share that when I started working with Honoring Choices Pacific Northwest, it took me about 18 months to do my own document. And it's because I kept thinking and hearing other people's input and, you know, trying to figure out who I think should be my healthcare agent and why. And then how do I tell the other people why they weren't selected as my healthcare agents? So it takes time. So don't think that this is going to be something you're going to sit down and do in a half an hour. It takes quite a bit of time to think through it. This again is the pulse. We've sort of already covered this, I think, unless there's any more questions about that. And then lastly is the resource page that I talked about. So I believe Kimberley is going to be sending you a copy of this in the email, so you don't have to write all these down. But I do want to point out that the resource link, the second one down, has a lot of, that's where you're going to get copies of the advanced directives or the healthcare directive. We also have a lot of tools to help you as you're working through. So there's this thing called the reflection guide. And I love this because it goes through, it talks about quality of life. You know, how do you define a good life? What do your best days look like? It talks about comfort and peace of mind. What would be important to you towards your end of life? Where would you want to be? Who do you want to be with? And what do you want to have surround you? So that's where you can put, you know, music, meditation, my dog, my family, you know, incense, whatever. And then there's also a place for cultural, religious, or spiritual practices that are important to you. So if you have specific things that you want to make sure happen, there's a place to kind of jot those down as well. So this is just a great tool to kind of get you thinking about, what am I supposed to be putting on my advanced directive? We also have a CPR guide. So if you want more information about CPR, you know, what is it? How successful is it? What are some of the side effects I might experience? The guide is very helpful to answer those questions. And then a couple other things we have are just some that, well, we have access to, it's a game called the Death Deck, and you can actually purchase it off of Amazon. But it's a game just to kind of get the conversation going, so it doesn't seem so daunting to have these conversations with family or friends. And the questions are things like, if a drug were created to provide immortality, would you take it? So it's just something to kind of break the ice, I guess, so that people aren't afraid to have the conversation. Do you want your death announced on social media? I think that's another good one. A lot of people are really into the social media and they would be fine with having it on social media. Other people would probably say, no, I'd prefer not to have it on social media, Facebook, etc. We also have a game that we've created with Honoring Choices. It's called Foolproof. And the idea with this one is, if there's just 10 questions and we have a timer, you don't have to use the timer, but the idea is that you go around the room and you ask whoever asks the most questions in a set amount of time, 5-10 minutes, wins the game. And so the questions are things like, in tough times, who do you turn to and trust the most? And it's supposed to be just a really quick, 1 to 2 minute answer. You don't even have to tell the truth. If you just want to make something up, that's okay too. But it just gets people thinking about the types of things that they want to think about. When's the last time you talked with loved ones about dying or death? Again, really quick answer, they sign it, you move on to the next person and ask the next question. So it just sort of helps again to break the ice. Another thing we have that you might find helpful, I know we're running low on time, is that we do offer 2 webinars. We call them public webinars. And the one is what is advanced care planning? So it's exactly almost the same presentation you heard today, but we offer it to the public. And we're going to be going to an every other month format. So 1 month it's offered on a Saturday, the next 2 months later it's offered on a Wednesday, I believe. And the second one that goes with that is completing your durable power of attorney for healthcare. So if you've done some thinking and you're ready to fill out the document and you just kind of want some help going through it, then that public webinar spends an hour and they just go through it page by page and tell you exactly, what to put on each section. And so if you're interested in those, down in the far right-hand corner is the events, and that will be on the document that Kimberley sends out as well. If you want to sign up for one of those webinars, that's where the link is for that. It's on Zoom. So again, it's similar format to today. And I already mentioned the Prepare for Your Care, the Conversation Project. Those links are also on here. So if you want to look at other documents, that's another good resource. And the Prepare for Your Care is actually offered in Spanish as well. So if you have Spanish clients, you're welcome to refer them to that. Okay, I think with that, I'm going to stop and just see if there's any other questions before we end the hour.
And I'm going to launch our last poll. So look for
That's
that.
right. I forgot about it again. Thank you. So do you have enough information to complete an advanced directive after listening to this conversation? Wow, we have 100%.
So far.
Excellent.
You're wonderful, Kim. You're so good.
Well, thank you. And I'm so glad all of you were able to attend. Spread the word. If you have people that you think would benefit from this webinar, it would, like I said, it's the same one that we offer to the public. And I don't remember if the next one is in May or in June, but it's free. You just register, get on Zoom, and they'll learn what advanced care planning is. So thank you all for taking the time, and I hope that you found it helpful. And reach out to us if you have any questions or need any resources. We're here to help.
I just want to say, I see people want contact information. I will be sending out the slides, and contact information will be on that. It's why we have you register, so I can send you things. So, so no worries, you will get that. And with that, I want to thank Kim Stagner very much for doing such a wonderful presentation. And you all have a wonderful day.
Yes, thank you. Take care. Bye-bye.
Bye.